Hi everyone, it's Rebecca, and today I'm talking about cervical screening, which is more commonly known as the smear test. And I particularly want to get this message across to women in the age groups between 25 and 30, because unfortunately, those age groups are more likely to develop cervical cancer. So why bother getting a smear test? It can be inconvenient, uncomfortable, slightly embarrassing, but it's vitally important because it detects abnormal changes in your cervix really early. And if we catch those abnormal cells really early, it's easily treatable and we don't risk them then changing into cancerous cells. It's as important as brushing your teeth. It's all about prevention. So the cervical smear test checks for those abnormal cells, and it also checks for human papillomavirus, which is a sexually transmitted virus and can be overcome with a robust immune system. Nutritional therapists can support you in improving your immune system to fight off human papillomavirus. So why is this young age group more susceptible to getting cervical cancer? Well, there's various reasons, and cancer is multifactorial. But for this particular age group, a lot of them are avoiding going for their cervical smears. They are run down, they lead hectic lifestyles, and they have an immune system that is not as strong in getting rid of a HPV virus. And they potentially increasing their risk of getting the virus if they have various or multiple partners. There are 3 key symptoms to look out for, but it's very difficult to attribute this to cervical cancer because they're quite common symptoms. But things like pain during or after sex, abnormal changes to your menstrual cycle, bleeding between periods, and changes in vaginal discharge are all things to look out for. But don't wait until those symptoms start. Just go for your check. It's only for about 10 minutes every 3 years, and it could really save you a lot of hassle in the future. So have this discussion. If you know any women in that age group that are putting off having their cervical smear test, have the discussion, let's get talking about it, and let's get them over there and get checked. Thanks a lot for listening.